First of all, a warm welcome to Mr. Raju Hirani, who has taken time for a very different kind of, I'm sure, event, one of first in his career, where he's actually decided and agreed to be part of trauma and acute care. And people would have wondered why he's here. I'll cover that when I'll speak about you later on, but my sincere gratitude, thanks, and we are honored to have you here. Thank you very much, sir. My colleagues from United States, UK, as we speak, we have around 8 nationalities being represented here other than US, UK. My friend from Kingdom of Saudi Arabia, friend from Kenya, Uzbekistan, Kyrgyzstan, Fiji Islands, everyone is here, and I think it's the beginning of a great movement. Why this is important and why we are here together? Throughout the day, we have heard a lot of people talking about creating systems. Everybody is aware of the data, everybody has spoken about data, the kind of mortality, the impact of mortality, the vulnerability of people, the amount of money which is being spent on infectious disease, and the amount of ignorance we have about the mortality which is arising in the age group of 1 to 45. And these are all young deaths we are actually seeing every day. What is the missing link in this entire piece? And why we still think that we have enough knowledge, we have adequate amount of skill set, but there is something which is lacking, and what is that something is more important for us to understand as we move forward. I would actually generally say that when you look at the emergency system of a country, it tells you the health of the country. Think about it. The reason is, when we say that you have advanced ecosystem developed about ER, it means the healthcare in that country would have reached a certain level, because there is a lot of backward integration required to put that system in place. We generally say call 911 and everything will start moving. To make that thing move, it means there is effort, as George said in his lecture. They started thinking about putting systems in place. It took a time, it took a resistance, there was pause, there were discussions, deliberations, who should give up, who should take up, why they should give up, and why somebody has to take that responsibility. Multiple things have to come forward, come together to make an ecosystem. When we decided on the concept of ITACC at that particular time, what was most important? What are we trying to do? Are we trying to create one more conference like many conferences? Is this a platform or is going to be different? When we started interacting, last year ITACC 1 was Delhi-Boston chapter, because me and Dr. Charu Paranjpe started talking about it. His passion about trauma was there. He introduced me to another person, passionate person, Dr. George, and we started discussing putting the puzzle pieces together. Let's actually create ITACC 1. Last time, this was a huge success. Professor Mishra sir, who set up the AIIMS Trauma Center, he was our guest lecturer at that particular time. We said, this is the first conference, let's think about it, have few lectures, what is the way forward? Then Dr. Raajiv Singhal came around. He said, we would love to participate and see if we can actually create something which is very different in trying to say, what are the learnings from India, US and UK? 3 big geographies, 3 big countries, 3 systems. Can we actually put a system which can address the global need? So ITACC is just not one conference. I want to say this is beginning of a movement where we are trying to set up a system where when we want to achieve the target 0 by 2030 at United Nations has said that there should not be any preventable death because of road traffic accidents. It can only happen when a lot of people who are sitting in this room pledge that yes, they are going to basically join hands in trying to make this. It will have multiple components: training, academia, as George mentioned, somewhere the financial aids, the government regulatory aspects. Mr. Vinod Kulkarni, who is from Tata Motors, who is here to support us in this cause here, he is here. You have to have a lot of agencies coming together to make this entire change. But when we go back from our conferences, most of the time, we go back to our normal life. If you will talk to any hospital today in Indian healthcare, if you ask any marketing head, do you want to promote trauma and emergency? He'll say, sir, I don't want to waste my time. Might as well basically promote cardiology, transplants, where I'll get my targets met and where I will basically drive more revenue to the hospital. That's the sad part of it. If all of us today who are sitting in this room can decide that when we go back, we want to convert our ERs into something as a movement where they become the best ERs, we commit to save lives. I think 3 years, 5 years, 10 years down the line, we will be part of creating this legacy. I do not want people just to be the lecturers for this particular lecture sessions. I want them to basically be part of something, a movement, where everyone who says, if I am coming to ITACC, my takeaway is, I will go back and change the ecosystem of my hospital emergency department. And we will try to build an ecosystem which will actually train people, teach people, upgrade the skills of the people, and save more lives. That is the most important part of it. If we are not doing that, I think we are just one additional conference which is basically put on your calendars, but I do not want one more calendar or a conference to take place. Now, what do we want to do over this entire concept? We said, let's actually create certain partnerships, alliances, and what we can offer to the world. Today, this India-US-UK concept can actually help, and we can go to Kenya. My Kenyan colleague is here. We can move to Kingdom of Saudi Arabia without any doubt. Uzbekistan, Kyrgyzstan, the world is waiting for us. If we all can put our minds together, we can change our countries, we can change the future. As George mentioned in one of your slides, you said, people in times to come may not die because of cancer or something else, because somebody is working on those particular areas. People are actually trying to develop therapies which will help you to conquer cancer, which will help you to basically treat something. People have conquered HIV to a great extent. We don't hear that much of stuff, but who is working on trauma? Nobody is working on trauma. That is the sad part of it. Is this our priority one? Is this our agenda one? As a healthcare providers, are we still divided that who should head my ER, where the admissions will go? I think there is a lot of detailing which is required at every step in every stage in trying to put what we want to develop. Fast forward, what I would prefer to see ITACC 5, ITACC 10. We should have change in ecosystem of at least 10 to 15 countries. Happy to take the challenge, move with the ecosystems of those countries, and try to develop system. Every system, it's like a Formula 1 race. Somebody will be in lap 1, somebody will be in lap 2, somebody will in lap 10. But we need to keep moving. We need to ensure that every car is moving in this ecosystem. Then only we will be able to change what change we want to see. That is the most important component of it. But that is what is expected from every one of us. We need to come out of our comfort zone. We need to challenge what we have been doing till today. Everybody is comfortable. Every person who is sitting in this room, I can assure you, they are in their comfort zone of their life. They are blessed because they are successful. The question is, after you become successful, what is your next goal in life? Are you willing to basically dedicate your life to make somebody's life better? Are you willing to dedicate your time and effort or your skill set in trying to make other people learn? Somebody taught us surgery. It's as simple as that, because that person decided that I would like to dedicate my time. One of my teachers is here in this crowd. Dr. Bhalla sir, you don't have to shy away. I was not that bad teacher. a student. The only thing is I'm saying that somebody decided that they would dedicate their life to teach somebody because somebody can be treated over a period of time. All of us, the neurosurgeons, the orthopedic surgeons, the general surgeons, the critical care people, everyone, the anesthetist, everyone has to contribute towards this. It's a mass movement. I expect, and my appeal to everyone is that let's pledge something where we can take this world to make this a better place for all of us, and we can see all youngsters living their full life, and basically they should not succumb to trauma. That will be my simple appeal, and I'm sure Mr. Raju Hirani will do whatever best he can do, because media and movie is something which will leave impressions in minds of millions of people. The reach is far more. We all have lived, we have learned, we have grown, we have seen the movies, we have actually, some movies have made impact. And he's a filmmaker, so my only point is, this trauma system development is like making a movie. If you have to have a blockbuster movie, it means every person who has to play the role, big or small, has to play a role to perfection. Whatever role has been assigned, Sholay was a blockbuster movie. Samba was given one dialogue. Every person remembers him. He played it to the perfection. Kalia died. So people, that is the reason I am saying, if we have to create this movement, I want everyone to participate in this. And from today onwards, from Marengo Asia side, I am committed to develop this to a next level, and I will ensure that we as an organization are dedicating and will find money to basically support trauma training, and also to ensure so that we are adequately funded. And somebody said, whether it can be a money earner. If you do good business, good money will come. But if you chase money, that is a bad business. Do not chase money. Save patients' life, that is the most important. That's the job which we are assigned to. We are actually lucky that we are in the profession of healthcare, and if we can treat patients, I can assure you everybody will make good amount of money. Don't chase money, chase good medicine, practice good medicine, and you will see that we will be able to bring the desired change in the communities in which we serve. So that's all I have to say. Thank you once again for coming across from all over the world and be here to praise this occasion of ITACC 2. And I look forward to seeing you in ITACC 5 and ITACC 10. Thank you very much.